A First Nation in British Columbia has declared a state of emergency over what it calls the unrelenting impact of drugs and alcohol. In particular, leaders are concerned about children and youth in the community, and they're calling on the federal and provincial governments to help. Let's bring in Hilary Johnstone, who has all the details on the story for us today. Good morning, Hilary.
Good morning, Heather. Well, what we're hearing from this First Nation, which is called Ehattesaht, is that they have lost 6 young people, early 20s to early 30s, in about the past year. This is due to drugs and alcohol. So the chief, Chief Simon John, has now declared the state of emergency, saying that they need help and they need it quickly because not only are they dealing with these deaths, but a quarter of their population, and there are only 500 people who are members of this First Nation, a quarter of them are either dealing with drug and alcohol addiction, are unhoused, or are suffering from some sort of other condition. They have children that are in care, for example. So if you take a look at exactly where this is, it's on the western part of Vancouver Island in a very rugged area. You can see it there. That is Ehattesaht First Nation. Like I say, only 500 people in this community. And we've heard a little bit more from the chief on all of this about why he thinks this is happening now, what is going on here. Here's what he said.
I think it's a long multitude of problems that have been put onto our community through generational, I don't know what you'd call it, under facilitation opportunities related to industry or economics or the viability of our community. It seems to be lost in time, basically.
And Heather, Chief John says that the impact of residential schools, the lingering impact, is also felt in the community. Chief John himself is a residential school survivor. He knew all these young people who've lost their lives personally, so you can sense the frustration, but then also the personal connection there as well.
Frustration, but you do sense a lot of pain in the community, Hilary, as well. What is the hope for what happens next?
What we're hearing from Chief John, Heather, is that he believes that the provincial and the federal government need to get together and coordinate on this, saying that when there has been help in the past, it hasn't lasted long enough. There hasn't been coordination within these various levels of government, because what we're hearing from Chief John is that at the end of the day, the only thing that matters to this community is its health. That is all that they have. Here's a little bit more of what we've heard from him.
We'd like health, basically, right? And we have a lot of opportunity related to reconciliation. Without health, there's not a lot of, purpose to what the government is wanting to achieve through reconciliation of lands and waters and rights and stuff as such. But in everything, we just want to be healthy and vibrant and want that opportunity to exist that hasn't existed in our community probably since the 50s.
So hearing there right from Chief John, Heather, that if you don't have your health, you don't have much. And this community is certainly crying out for help right now so that they can try and get back on track.
Hilary Johnstone from Ottawa, thank you very much.
Thank you.